Welcome, listeners, to another episode of the Health Boost Show, where we explore the latest trends, debates, and discoveries in the world of health and wellness. I'm your host, and today we delve into a fascinating topic that has captured the attention of many: CBD oil. Many of you might be wondering whether CBD oil is the miracle cure it's made out to be, or if it's just the latest in a long history of modern snake oils. So, let's unravel the mystery together and uncover the truth behind this popular product. First off, let's discuss what CBD oil actually is. It stands for cannabidiol, which is one of over 100 compounds found in the cannabis plant. Unlike its cousin tea, which is the compound responsible for the psychoactive effects of marijuana, CBD does not produce a high. Instead, it's been touted for a range of potential health benefits, and as such, it has sparked a multi-billion-dollar industry. The production of CBD oil involves extracting cannabidiol from the cannabis plant and diluting it with a carrier oil, like coconut or hemp seed oil. And with the rise in its popularity, CBD oil has found its way into a variety of products, from tinctures and edibles to salves and vaporizers. Now, why has CBD oil become such a talked-about subject in health circles? The answer lies in its purported abilities. Advocates claim that CBD oil can alleviate chronic pain, reduce anxiety and depression, aid sleep, and even act as an anti-inflammatory. But with these claims come critical questions. What does the scientific evidence actually say? Are these benefits backed by rigorous studies? Let's start by examining the scientific research on CBD's supposed health benefits. One of the most well-documented uses of CBD is in the treatment of epilepsy. In fact, the FDA has approved a CBD-based drug, Epidiolex, for treating certain forms of epilepsy. This approval came after extensive studies showed that CBD could significantly reduce seizure frequency. This is one of the rare instances where we have solid scientific backing for CBD's efficacy. Beyond epilepsy, the most commonly advertised benefit of CBD is its effect on chronic pain. This has made it particularly appealing to those who suffer from pain conditions like arthritis or fibromyalgia. Some studies do suggest that CBD may help reduce pain and inflammation, but many of these are animal studies or small-scale human trials. The human body is notably complex, and what works in mice doesn't always translate directly to human effectiveness. More large-scale controlled studies are necessary to confirm CBD's role in pain management. Another area of great interest is mental health. Anxiety and depression affect millions worldwide, and there's a significant appeal in finding treatments outside of pharmacological drugs which can have numerous side effects. Some research indicates that CBD might have therapeutic effects for anxiety, serving as a calming agent without the intoxicating effect of THC. Again, while some initial findings are promising, they often come from short-term studies or studies with small sample sizes. It's also crucial to note that these studies don't fully explore long-term effects or the potential for interaction with other medications. Let's not forget about sleep, a field where everyone seems to have at least one or two tips for improvement. Proponents of CBD oil suggest that it can help with sleep disturbances or even insomnia. Some small studies have shown potential, with participants reporting improvements in sleep quality. However, sleep studies can often be subjective, and individual expectations can heavily influence perceived outcomes. So, while CBD could potentially aid in sleep, we again find ourselves needing more robust evidence to make definitive claims. Next, let's explore CBD as an anti-inflammatory agent. Inflammation is a culprit behind many chronic diseases, and reducing inflammation is a major focus in various treatments. CBD's anti-inflammatory properties have been observed in some laboratory and animal studies, and there's buzz in the medical community about its potential. Nevertheless, translating these findings into clinical practice for humans is another hurdle altogether, and definitive conclusions can't be drawn without more comprehensive human trials. You might be wondering, why is more research not available yet? Well, there are a few key reasons. Firstly, the legal status of cannabis, including hemp-derived products like CBD, has historically restricted the ability of scientists to conduct research. It is only in recent years that legislation has eased in many parts of the world, allowing for more research to commence. With CBD now legal in many areas, studies are certainly on the rise, though it will take time to build a comprehensive body of scientific literature. Secondly, the supplement industry, which includes CBD products, doesn't face the strict regulations that pharmaceuticals do. This means that those selling CBD aren't always required to prove the effectiveness of their products through rigorous clinical trials. For consumers, it means that marketing claims can often outpace scientific validation. Now, having explored the current state of scientific evidence, let's consider the aspect of safety and regulation. One of the biggest questions hanging over CBD oil is it safe? The World Health Organization has stated that CBD is generally well tolerated with a good safety profile. However, that doesn't mean there are no risks. The truth is that everyone's endocannabinoid system, the network your body uses to process cannabinoids, is different. Hence, the effects of CBD can vary significantly from person to person. For some, CBD can cause side effects like fatigue, diarrhea, and changes in appetite. Additionally, CBD can interact with certain medications, particularly those with a grapefruit warning. Quality control is another significant issue. The largely unregulated nature of the CBD market means that products can vary considerably in quality. Studies have shown that some CBD products do not contain the levels of CBD advertised on their labels, and some may even contain harmful additives or contaminants. It's imperative for consumers to do their homework and choose products from reputable suppliers who provide third-party lab testing results. This testing can confirm the product's cannabinoid content and ensure it is free from contaminants like heavy metals, pesticides, or solvents. We've covered a lot of ground in terms of science, safety, and regulation, but there's another layer: the personal stories and experiences that fuel much of CBD's popularity. Testimonials are powerful, and many people swear by CBD as a life-changing supplement, sharing stories of improved wellness and quality of life. These personal narratives often drive public interest and demand more than scientific studies do. While individuals' experiences can be incredibly compelling, we must be cautious not to treat such anecdotes as evidence. The placebo effect is a well-documented phenomenon, and when people believe strongly in the efficacy of a treatment, they might perceive improvements that are not directly attributable to the compound itself. It is a double-edged sword. While personal stories can provide valuable insights and ignite further research, they should not replace scientific inquiry. In many ways, the story of CBD oil reflects the larger dynamics in alternative medicine, the tension between patient experiences and empirical research. It invites questions about how we approach new treatments, manage expectations, and promote public health. As our episode today unfolds, consider this dichotomy. The possibility of a new therapeutic agent versus the history of products that promised the world and delivered nothing more than placebo. Both sides of this spectrum invite critical thinking and cautious optimism. Before we close, let's take a moment to glance towards the future. What does the horizon look like for CBD oil? With increasing legalization, research is expanding, and we'll likely see more comprehensive studies soon. Areas of interest such as neuroprotection, cancer treatment, and addiction therapy are emerging, where early findings suggest CBD might hold potential. Moreover, advances in biotechnology may lead to better formulations, optimizing bioavailability and effectiveness. As the conversation around medical cannabis continues to evolve, CBD could well find a place in established medical practice, or perhaps serve as a bridge to uncovering other therapeutic compounds within the cannabis plant. The nuanced picture of CBD oil, its possibilities, limitations, and the road ahead, epitomizes the dynamic nature of health and wellness science. It reminds us that breakthroughs don't just happen. They require exploration, validation, and patience. So the final question remains, miracle cure or modern snake oil? The answer, for now, resides in a gray area. CBD oil is neither a panacea nor a placebo, but a promising compound with both anecdotal support and scientific inquiry to back its potential. Its journey is a testament to the intricate dance between science, society, and the profound human desire to find new pathways to health and well-being. Thank you for tuning in to The Health Boost Show. As always, we encourage our listeners to approach all health claims with an open yet critical mind. We look forward to joining you for our next episode as we continue to explore the multifaceted world of health solutions. Take care and be well, everyone.